I have a question for you. So a lot of people will come in and they've heard these talks, they've heard about fatty liver or MASLD, and the number one question I get is, how do I know if I have it? And I'll often hear things like, well, my doctor checked my enzymes and it said my liver looks just fine. And
Yeah.
so could you speak to that?
Yeah, thank you. What an important question. So your liver enzymes can sometimes correlate with how much damage or inflammation is in your liver, but very often don't. Up to 30% of people that have advanced liver disease from MASH will have normal liver enzymes. And it's because, and by the same token, you can have very, very high liver enzymes, and there might be some inflammation in your liver, but there might be no damage. And so the best way for us to assess both, is there fat in the liver, but more importantly, do you have MASLD, just plain fat in the liver, or do you have MASH, fat that causes inflammation and damage? Probably the most effective way that we can do this is a test called elastography. There's a bunch of different modalities. There's an ultrasound-based one. There's something called shear wave elastography. There's radio frequency, something called RF. There's a bunch of different types of modalities that what they're all doing is measuring the stiffness of the liver. The most common one I should just mention is something called a FibroScan. That's the one that's probably most widely available. But there's all different companies that are making new technology that all are trying to measure liver stiffness. And the reason we measure the liver stiffness is because the stiffness of the liver is a correlate for how much scar tissue or damage is present in the liver. All liver diseases lead to inflammation, and inflammation leads to scarring. And as scarring progresses, that's how you get to cirrhosis. So using the stiffness of the liver, we can make an approximate guess for how much damage is present in the liver. Now, that same technology can often measure the amount of fat in the liver. And so if we see fat in the liver, plus a lot of stiffness, plus a lot of scarring, we know you have MASH. We have that more dangerous version of liver fat. If we see just plain fat in the liver without scarring, we know you more likely have, we know you have MASLD, but you probably don't have the dangerous version, MASH. But the shorter answer to your question is we can see it on ultrasound or liver biopsy. But also like any imaging of the liver. That's the way to definitively say that. But again, when we're talking about 35% of the population, we're talking about risk factors like high triglycerides, diabetes, excess body weight, especially if you gain weight in your midsection. That's so many people, right? We're not going to be screening everybody. So the current guidelines that have been put out by Endocrinology, Liver Society, and Primary Care is that we need to find the people that are the highest risk, not just for having fat in the liver, but having the dangerous fat in the liver. And so the people that have been identified are people that don't just have obesity, but have medically complicated obesity, right? So not just I have obesity, but I have obesity with elevated triglycerides. I have obesity with high blood pressure, right? And so what the strongest correlate is probably obesity with 2 metabolic risk factors, or people with diabetes, right? From a metabolic standpoint, that is the single most important risk factor, is diabetes. But there's other populations that you don't always think about. So those are the people that when you're saying, hey, do I have liver fat? I have normal liver test, but you're diabetic and have high triglycerides and you gain weight in your midsection, you should probably get checked out, right? And there are ways that we'll talk about that you, without having a specialty test like liver stiffness, that you can at least do a rough guesstimate for your risk of having advanced liver disease. But beyond just the people with metabolic syndrome risk factors, it's also people with a family history. So anyone with a first-degree relative that's had cirrhosis from MASH has a 12-fold increased risk of developing advanced liver disease, or of having advanced liver disease. People with metabolic syndrome who drink a normal amount of alcohol have a massive increase in their risk of having advanced liver disease. So it's interesting, the synergy. So alcohol also causes fat in the liver. And the synergy between alcohol-related fat and metabolic-related fat is really remarkable. We're talking about a 3 to 7-fold increase in risk. And
Wow.
I want to be clear what I said there. That's a moderate amount of alcohol. That's not excessive alcohol use, right? So if you fall within the CDC guidelines of, 10 drinks for a woman, 20 drinks for a man, and that's even being conservative in some measures, just having that amount of alcohol plus metabolic syndrome massively increases your risk compared to just having metabolic syndrome alone. And the opposite is also true. If you have alcohol use disorder with or without metabolic syndrome, it makes a huge, huge difference.